All right, let's bring in the idea of edema. Now that we know the forces, all right, we know the forces. If they go awry, you could get edema. Because edema is accumulation of fluid in the interstitial space. All right, what could cause it? Well, let's start with hydrostatic pressure in the capillary. If hydrostatic pressure in the capillary goes up, promotes filtration, could get edema. Well, vasodilation would increase the blood flow, and a high blood flow could result in some degree of edema. Next, venous pressure, venous pressure, venous pressure, capillary pressure, you bet, capillary pressure. All right, what causes that? Venous obstruction like a DVT. Heart failure, another beautiful example of a rise in venous pressure causing the increase in capillary pressure can cause edema. Okay? Next, blood volume directly related. Well, that relates to sodium. You regulate sodium to regulate volume. Regulate sodium to regulate volume. You expand extracellular volume in heart failure, you got a big increase in blood volume, it could be edematous. I could also increase the oncotic in the interstitium. About the only thing that's going to do this that you have to worry about on step 1 is hypothyroidism. That's myxedema. Now, this is a little bit different type of edema. The elevated oncotic pulls water, but the tissue is stiff. So when you press on it, it doesn't push in. We call that what? What kind of edema? This is a non-pitting edema. Contrasted to one up here, and where you have a pitting edema. It means you push and the tissue gives way, you pull your finger back and it takes a little while for it to come back. That's a pitting edema. Hypothyroid myxedema is a non-pitting edema because we have a lot of osmotic force in there. Mucopolysaccharides are elevated, and as a result, you get a non-pitting edema. Yeah, I know maybe somebody already said it, but yeah, it can happen in hyperthyroid with that pre-tibial myxedema. Yeah, but myxedema is a more generalized, and that's characterized by hypothyroid. Yes, you can get a pre-tibial and hyper, but typically when we think of myxedema, it's hypothyroid. And we'll mention that again when we talk about thyroid function. All right, if I lose the osmotic forces in the capillary, then I'll promote filtration because I'm losing absorption. What can do that? Well, where's albumin made? The liver. You go into liver failure, you lose albumin, you lose vascular oncotic, edema. The other one in the kidney is nephrotic syndrome. All right, is nephrotic syndrome. The reason it's non-pitting for this is because it is being pulled in by osmoles. It's not really, these are more pure water. This is being pulled in because of the osmotic force. So it's holding volume, but because I have a lot of osmoles in there holding it. And so that's why it doesn't give. These others are mostly water. This one's water and solute. That's the easy way to think of it. So again, decreased vascular oncotic pressure can occur with liver failure or nephrotic syndrome. All right, the other will be an increase in capillary permeability. Someone mentioned bradykinin, excellent, high yield for step 1. Other one for step 1, histamine. Other one for step 1, TNF alpha. This is tumor necrosis factor alpha. This represents inflammatory type responses in which you will markedly increase capillary permeability. In nephrotic syndrome, yes, you lose proteins in the urine. You lose proteins in the urine. All right. So again, for step 1, TNF alpha, that's a big one. It's one of our cytokines. Histamine and bradykinin, all of those increase capillary permeability and will tend to cause edema. And this will be a non-pitting edema. This will be a non-pitting edema usually. And last but not least, don't forget the lymph. All right. W. bancrofti. You can also get streptococci, bacterial lymphangitis. All right. Streptococcal infections can also cause it to some degree. Another bug, 2 bugs. Ooh, ooh. And if you remove it or you get a tumor, anything that blocks it can cause a lymphedema. Now, this can also be non-pitting because it's keeping proteins in the interstitium. It's keeping proteins in the interstitium. So there's another example of a non-pitting edema. All right, now, yeah, mastectomies, exactly. They used to do that. It used to be a big problem in the mastectomies. They used to just take all the lymphatics out. They're trying to do that less and less when possible. Nephrotic is a pitting edema. Nephrotic is a pitting. The only pittings will be mixed edema and oftentimes with lymphedema. Those would be, that. I said that backwards. The only non-pitting will be mixed edema and the lymphedemas. All the rest will be pitting.